Pseudo-Gout or Chondrocalcinosis refers to attacks of synovitis induced by deposition of calcium pyrophosphate dihydrate crystals, that's CPPD crystals. And most patients are old females. It behaves like gout in many respects, but unlike gout, the attacks persist longer and affect the knee most commonly. And common risk factors include trauma, surgery, severe illness, thyroidectomy, and palmidronate therapy. And comorbidities for this condition are usually cardiovascular, renal, and metabolic diseases, for example, diabetes mellitus, deposition of calcium pyrophosphate dihydrates crystals in and around joints. The symptoms are joint pain, swollen joints, and the signs that are usually elicited are swollen joints, tenderness, joint effusion. Investigations are serum uric acid, X-ray of joints, microscopic examination of joints, or basal fluid aspirate. The main treatment objectives are to relieve pain, prevent joint stiffness, and eradicate disease and correct underlying metabolic derangement. Non-pharmacological treatment, physiotherapy is recommended. Of pharmacological treatment in acute flare-up, the first-line treatment, you give naproxen EC oral in adults 250 to 500 milligrams 12 hourly as required. In children is not indicated. Or you can give celecoxib oral in adults 400 milligrams start and then 200 milligrams 12 to 24 hourly as required. In children is not recommended. You can give diclofenac oral in adults 50 milligrams 8 hourly or 100 milligrams 12 hourly. In children more than 12 years, you give 50 milligrams 12 hourly, or less than 12 years is not recommended. Or you can give ibuprofen oral in adults 200 to 800 milligrams 6 to 8 hourly as required. And a maximum of 2.4 milligrams daily. In children, you give 10 to 15 milligrams per kilogram 6 to 8 hourly as required, with a maximum of 40 milligrams per kilogram daily. Or colchicine oral in adults 500 micrograms 6 to 12 hourly. In children is not recommended. So guideline treatment, you give prednisolone oral, but you have to consult a specialist. You can also give methyl prednisolone acetate intra-articular and triamcinolone intra-articular. So you have to consult a specialist too. And metazone intra-articular. These you have to consult a specialist. For third line treatment, you have to consult a specialist in the medications that I'll be mentioning. So probenecid and methotrexate, phosphocitrate, and anakinra. So these medications you have to consult a specialist. Referral criteria is that an analgesia and referred to a rheumatologist or orthopedic surgeon.